Actually, when we were given the initial diagnosis, we were given the wrong information, which at the time I didn't realise, but now, because of the experience I have had with working with the community, I now understand. The consultant that gave us the initial diagnosis talked about the symptoms and the progression of type A, which is a lot more severe. And so he said that we had 6 months, if that, with our child. And the words he used were, "You could take her home to die." He also said some other things that will always stay with me, and I think I would love to revisit that appointment with him and to have the strength to talk back and to tell him how much of an impact his words had upon us. He destroyed us completely within that appointment. And obviously delivering news like that is very, very difficult, but I feel that there must be more sensitive ways. I think it's a very difficult one. I think whichever way they do it will be difficult for the parents, but to do it as sensitively and as gently as they possibly can. I don't think at the point of diagnosis that it's important to give full information. I don't think parents can take it in. I think parents will hear the words that you utter, they have this condition, and they will hear no more. They'll go away and then they'll have to think about it, and it's in subsequent appointments and with support from patient groups and others, community teams, that you deal with what the condition is and what happens next. But I definitely think that when you're speaking to parents for the first time and delivering awful news, that they must have somebody there with them who can support them and who can listen for them, and that you should talk to them as gently as possible.
And do you think?
Absolutely, yes. If they can give you information about the condition and perhaps about the patient group that supports your condition and where to go for help or counselling or who to see next, then that would be really useful.